Good afternoon and welcome. Thank you for joining us for our training, Supporting Healing from Grief and Loss in Nursing Facilities, hosted by the Center of Excellence for Behavioral Health in Nursing Facilities. I am Nikki Harris, Training and Education Lead for the Center of Excellence, and it is my pleasure to oversee the delivery of mental health and substance use disorder trainings to nursing facilities nationally at no cost to the nursing facility. And now I am happy to introduce our presenter for today, Ms. Diana Padilla. Diana has more than 24 years of experience in the behavioral health industry. Her vast experience includes service provision to diverse communities with substance use, HIV, HCV, trauma, stress, and other psychosocial conditions. Currently, Diana is a senior staff trainer for the Northeast and Caribbean Addiction Technology Transfer Center. I'll now turn it over to Diana to begin the presentation.
Thank you, Nikki, and thank you, Derek. And thank you, everyone, for being here. I just wanted to, I wanted to kind of give us a blueprint of what we're going to cover today. We're talking up here, we're going to be speaking to supporting healing from grief and loss in nursing home facilities. So we will cover or review some of the griefs that have been identified in research and what therapists and the experts have been saying and the symptoms, as a way to start to build our awareness. We're also going to consider the 5 stages of grief and the potential impacts, which is a really helpful way to be able to identify potential behavior or issues that your residents may experience. And sometimes we can actually apply these stages to ourselves as well. So we're going to list some strategies for self-supporting healing. And also, I want to introduce to you a term, postvention activities, and really refers to how your setting, how your organization, how the nursing home facility themselves can actually incorporate immediate supports to provide both residents and staff around a grief and support the healing process for everyone. Some of the things to first start off with is like think about how we think about losses. When we think about the word losses, one of the first things that kind of comes up is someone has passed, someone has transitioned. And so when it comes to nursing home residents, there are different types of losses. And sometimes we're not necessarily aware, or maybe we don't recognize, but some of the things that we have noticed, you as nursing home staff better than anyone have noticed, that sometimes the change in how the change in a person's ability to actually do for themselves, their independence, the change of environment, all of that can speak to loss. The biggest loss we think about first is a partner, is a spouse, or another family member, and persons that are most times we are very emotionally attached to. So when we think about residents with their in terms of loss, we can consider this as well as other, say, social folks in their social gathering, like for instance, friends. And also think about friends, not just lifetime friends, not just friends, not just like the friendships that they had developed before they went into the nursing home residential facility, but also about those alliances and those friendships they develop with other residents in care, despite the differing medical issues. When you are in a place in over time and you get to know other folks there, you develop a relationship. And so then the loss of independence can be very drastic for some folks. It may not necessarily have been a situation where the person's health started to debilitate and they eventually segued into getting help from a residential facility. It could have been very abrupt as well. And so someone who's been independent most of their life is it can be very difficult to deal with and come to terms with that loss of independence and relearning, a new way of actually living. So loss of physical abilities and cognitive function, loss of home and car. Sometimes we don't even think about that as a potential issue, but just part of independence and part of your ability to be able, or a resident's ability to be able to do certain things for themselves and not being able, and perhaps because of their condition or the situation that they're addressing in the facility, they do not have access to that type of activity anymore can be very impacting. And then we also might want to consider when we have residents who may have some mental illness to different degrees, and how loss may impact them, or someone who may have. Sometimes we do know that somebody has a diagnosed substance use disorder. Very, very often, we may have folks here that in your residential facility, you may have folks who are in recovery from an alcohol or another psychoactive substance in their life. That's not part of data that you collect. That's not necessarily documented. And residents might start to have an impact behind another resident loss. And so there are different things that folks might do. Persons who experience losses, really it's helpful, particularly with those with substance use issues, or in recovery from substance use, or persons with mental illness. You want to consider that it's helpful to have a plan in place, so the person can get the support they need, and you understand how you can support them, so they can be able to process their event and not necessarily deal with grief by, say, having a recurrence or relapse, which is very possible. So these triggers it really exacerbates anybody's coping skills. And certain folks might have certain vulnerabilities that might increase that risk. And so unhealthy coping skills and other mental health conditions can certainly exacerbate conditions for some folks, for some of your residents I'm speaking to. And so you folks have, the participants here on the platform, I can see that you have access to the chat box. So I'm wondering, in your experience, what are the emotions that you notice in the residents that you work with, that you provide services to? What have you noticed when they have experienced the passing of another resident in the facility? And if you can, please put it in it. Okay, thank you, Amy. Anger, yes. Sure, a sadness, and often very severe sadness. Personal isolation can be such a reaction behind another person's passing. Sure, depression, certainly the grief, the confusion. I like that. Withdrawing issues. So withdrawing from activities, withdrawing from engaging from others. And even in a residential facility, you have the ability to be able sometimes to see a certain resident to withdraw from their daily activity or their normal reactions, normal interactions with other residents. Thank you for that. It's helpful to have your awareness up around that. If you're familiar with how a person engages, and you start to see a difference in how they interact with other people, or stop interacting with other people, or how their interactions change, that can be an indicator that lets you know that they may be having a difficult time dealing with the loss. And so some of the symptoms that we noted here, thank you for putting those responses in the chat box. Some of the symptoms include intrusive memories about the loss. So it doesn't necessarily happen that automatically, that someone kind of just deals with it, and it just stays like a conscious experience. Intrusive memories about the loss can occur for a lot of folks. Sometimes there's numbness, the avoidance, emotional numbing. And we're going to cover some of this in the stages, the 5 stages of grief. Sometimes the physiological arousal. And so that's really specifically speaking to. So you mentioned, you folks have mentioned in the chat box, the anger. So anger or the irritation, and not necessarily irritation, or sometimes a sense of increased stress when interacting with other folks, because that anger is being reflective, whether they are aware of it or not. It could certainly have an impact, and they may not necessarily be aware that this is happening. And you might be the person who can best observe that. And sometimes sleep patterns, having a hard time sleeping. So obsessive rumination regarding the loss, kind of just not being able to think about anything else but that passing of the individual, perhaps even the circumstances around it. So it makes it difficult for some people to actually focus and perhaps even enjoy or engage in their daily routines. Sometimes some residents may actually have a hard time, you know, smiling again and enjoying even the visits that they will get from other participant, other family members, of friends. So the feelings tend to always present. They tend to seem to last. And so grief can be defined as emotional, it's also psychological, and those are reactions to a loss and considered a significant loss. And when I say significant, one of the things we want to keep in mind is that that's subjective. It depends on the individual and that how they internalize and they define loss. So symptoms can include feelings of shock and horror. And so very often think about how a resident may have just spoken to someone, um, had just gotten up that day and they remember their last conversation was with another resident. They wake up, they find out that the other resident has passed. That can be immensely and intensely shocking. And so it can increase anxiety and fear, nihilism, that emotional withdrawal that you folks mentioned. You all mentioned all of these. The symptoms can last anywhere between a few weeks, which is certainly a normal process, to many years. And that's the thing. There are no predictive, um, observable symptoms that will indicate that it can last for a long time. What we want to do is be able to be mindful of those folks who seem to be feeling or going through grief even after a long period of time. So I'll give you some more information about that. So it can certainly be psychological, certainly be emotional. It can be spiritual, depending on the individual and their own belief systems. It could be behavior. It certainly be reflecting in behavior. So people do grieve differently, and that's why there is um, no set templated approach to helping folks pass the grief. You know, some people might grieve very intensely after losing someone. Some people might grieve intensely with someone they form a friendship with, and not as intensely with a family member. There is no predictors that, like I was saying, but they can have but those who they tend to have a friendlier or more emotional connection tend to be foundational to the intense feelings that people that residents may be experiencing. So some may find that they cope quickly after losing someone, but some may have strong, with whom they had strong, healthy relationships. It may incorporate some of those their own internal philosophies of how they see life and how they see transition. It can depend on a lot of that. So different types of grief, just to cover a few here. Integrated grief is a form of grief that lasts, that has a place in everybody's life. And so the way that it's indicating here. So many of us have had those experiences where surviving the pandemic, being able to not just in the residential facility, but also in general, we've all have experiences with, we seem to have all had experiences with loss. And many people tend to go back to their life as if everything is okay. Well, a resident might not be able to do that. Integrated grief means that they may be able to go through the feelings, they may be able to understand and give themselves time to adjust, to accept the reality of someone's passing, but it doesn't necessarily impact their day. And so integrated grief is kind of a normal process just for anyone, but another normal process for other folks, for other residents that you might have, and this might be something for you to be to start to be aware of, is typical grief. And those are intense feelings. And intense feelings tend to abate over time. So they might be initially seem very harsh, very stark, but they do go away after a little while. And so that's also normal. And so, it's normal, so subjective. And that's why I use that word so much. And especially in the early months, the periods of sadness can be very intense, but it will go away after a while. So some of the situations that we want to be mindful is when it's complicated. When it's complicated grief, we're talking about grief that is that lasts, can last very intensely and can last over a long period of time. Even though grief lessens over time, which is like typical grief, but and you can continue forward with complicated grief. Um, it the feelings can be very intense at different times. It can be reflecting anger and bitterness, maybe a constant state of anxiety, a constant state of fear. Um, there can be a whole complete avoidance of situations. There can be deep grief um, that might result in the inability to have that smile again, to actually accept the passing of another individual. It can impair, um, relationships that they have with other residents and other family members who come to visit. It can be debilitating in a lot of different ways for years to come. And so one of the things that you folks mentioned, and I'm glad you did it because I have a slide on this, is also like the difference between grief and and depression. So symptoms can last for a long period of time, can go away after, say, the initial first few months. But the reality is that depression tends to have consistency of feelings, consistency and sometimes progressiveness in terms of how the diagnosis and how the illness itself kind of affects people. So with grief, eventually folks can get to acceptance of a person can accept support, can accept allyship, can accept different ways um, to consider ways to heal. So someone can, but even though someone can avoid initially, have a response or reaction to the loss, everyone is allowed to have that grieving or that mourning period. The difference between that and depression is that depression will tend to isolate people and and many people may end up being acting or reflecting as if there was they're reclusing from society in general, perhaps barely responding to nursing home staff, perhaps barely responding even to their treatments and not with much energy or much commitment on their part. And so it tends to be more consistent. So the ability to function is associated with grief, but depression symptoms can be severe and consequently diminish the ability to perform important tasks. And we know that a lot of our residents need physical therapy. A lot of our residents need to kind of at least take walks around the area. Folks need to, or oftentimes your residents just, it's a matter of being able to feed themselves, being able to go to the restroom and take a shower, do certain things on their own. When they stop being able to do that, sometimes that can be symptomatic of depression. And those you tend to have diagnosed already. And so when someone is clinically depressed, they may experience these symptoms and are unable to do all these things. With the grief, the grief, we can see some of these signs and symptoms, but they tend to abate over time. What can be helpful here is for us to understand the 5 stages of grief. This was developed years ago by Dr. Elizabeth Kubler-Ross. She's a Swiss American psychiatrist, and she had done such an amazing job in being able to kind of put in parameters the common reactions that many people tend to have in terms of after a loss. Doesn't mean that everyone goes through it and not everyone goes through it in a linear process, but it does start to explain how we can understand and be able to support individuals or residents who have gone through a loss. And so the first stage of grief is really that denial period. It can be overwhelming in emotion. It's pretty common where many people, staff, residents, anybody in general can actually experience a loss, and it could be at first surreal. Like it may be hard in the moment to adjust. Human beings are not like switches. We need a time to process information, particularly information that has to do with someone not existing in our physical world anymore. And so it's pretty common that someone could respond with strong and sudden feelings of disbelief and internalizing that loss as not real. That sense of surrealness. And so the idea with that is that, giving time and space for someone to be able to adjust to that, because I don't know that there is such a thing in the English language or where someone can get past it. But it is time, it is an opportunity for nursing home staff to be able to support. So for instance, behind a breakup or a divorce, someone, there are things like they're just upset this will be over tomorrow. That that denial thing is like, depending on the kind of loss, someone may be saying things like, oh, they were mistaken. They'll call tomorrow to say they need me. They just got fired or they just got let go. There's downside, company's downside. They didn't tell anybody. It could be very abrupt. The death of a loved one, or even someone who you are used to commonly seeing around you, for instance, a resident with other residents in the area and in the facility, it's like, no, they're not really gone. They'll come back around the corner any second now. So it takes time for that mind to adjust. Sometimes with a terminal illness diagnosis, you'll hear some type of verbiage that speaks to like, it's still happening to me, the results are wrong. Like it's hard to accept. So as you move out of, so the denial and shock gives the mind allows the individual to have time to be able to process. And so in a way, it's kind of like emotional protection, until the person can begin to process. And that process can begin with your support, with you being able to be an ally, you use that wonderful way, that a wonderful empathetic way of how you folks do services and how you folks interact with residents. And that can be helpful in the moment for a resident just in that shock period of denial. The second stage of grief and what to express kind of speaks to anger, where denial may be considered a coping mechanism. Anger is more masking it. Anger can be, not everyone will experience this particular stage, but there are times where someone is amazingly angry or irritable. Anger is hiding many of the emotions and pain that you carry. And so sometimes when if a resident loses a family member, residents, if you've ever experienced a resident where they lost their parents or a resident lost their child, you can see a lot of the anger and irritability and the lack of being able to actually process in the moment. But as anger subsides, the person may begin to think more rationally about what's happening. And so say it's a breakup or divorce, you might hear something like, I hate him, I regret leaving me. Or the loss is about the job, and it's like, they're terrible bosses. I hope they fail. The anger behind the death of a loved one is like, if she cared for herself some more, this wouldn't have happened. There's a certain part of that, it's like, which just that the mind is trying to make sense out of the person's passing. So terminal illness is like, where is this God? Where is God in all this? How dare God let this happen? Whether it's God or blaming facilities or blaming family members, there's a blame game that goes on here. And that's not everyone, but you might see some of that so that this can be helpful. Stage 3 of grief can be bargaining. If you've ever heard anyone kind of say, like when they've heard, when they just found out about a passing of someone, where they are still in their disbelief, maybe in that time they feel they're feeling those feelings of vulnerability. The feelings can be pretty intense. There is a sense or an attempt to try to regain control of their mental state, of their world. They may find themselves creating a lot of some of the comments can be like that thinking where someone said, but if I had done this, maybe they would still be here. What if they had done this, they could be there, and so if only statements are being made, that person can be in that bargaining stage of grief. And so if only I spent more time with her, she would have stayed with me. That's behind a breakup or a divorce. Or if only I worked more weekends, I would have seen how valuable I am. They would have never let me go. Or if I can go back to the last time I spoke to her, maybe this would not have happened. Maybe I missed a sign or something. Maybe I could have done something. Terminal illness, if only we had gotten to the doctor sooner, it could have stopped this. It could have saved his life. And so we start to see that this type of verbiage is likely reflecting the bargaining stage of grief. Depression, as some of you folks have mentioned, at this point, you may be able to embrace and work through the reality of loss in a healthy manner. It could happen. Depression can give you that opportunity. In the early stages of loss, a resident can be running from their emotions, but trying to stay a step ahead of them. But at this point, they may be able to um, think about a way to adjust to the news. And so why go on? And so sometimes when folks have a hard time coping with it, the depression can kind of make them a recluse or isolate mentally. And so behind the divorce, why go on at all? When you hear verbiage like that, that can be an indication you want to keep up your red flags. For me, what it does to me is reminds me that a resident may be feeling at a loss and lose their motivation to want to live. And that's an indication for extra care and extra monitoring. A job loss, I don't know how to go on from here. Oh, what am I without her? You know, when you hear things like this, my whole life comes to this terrible end. You know, when you hear things like this, it's that depression kind of setting in. It doesn't, it's not that well defined, but there's a sense with some folks that they may feel a little foggy. The resident may be feeling slightly confused, and this may not be what's normal for you to see in that particular resident. Depression itself can be like that, like an inevitable feeling of loss where it's hard to kind of grasp, where you can't ever get to uh, uh, any kind of place where you can adjust to it, where you can accept it, where you can put a closure to it. But the thing is to talk with someone. This is at a time when, and particularly when it's not a diagnosable depression, sometimes there's such a thing as episodic depression. That can be something that can occur with an individual as a result of a person's passing, where they're having a very, very hard time adjusting and dealing and accepting it. The stage 5 of grief, it's one of the ones where if someone were to go through these stages or any one of these stages end up in acceptance, then it typically speaks to a certain level of adjustment. And so where it is accepted that the individual had passed, whether it's a family member, whether it's a friend, whether it is another resident. And so if you passed, you've adjusted to it, does not necessarily mean you've gone through all the feelings and those feelings will no longer come back, but you find the resident can find it easier to allow themselves the time to feel the feelings, and they will eventually come to terms with it. So it can describe the whole pace of accepting the reality of loss, and they can adjust in a way where they can acknowledge the loss and still kind of move on. And so ultimately, this was the healthy choice for me, can be a potential verbiage behind a breakup, trying to get past it and accepting and kind of still moving on. Just the kind of verbiage that we're looking for here. So jobless, I'll find a way forward from here and start a new path, or I'll just get another job. This is not the end all, opportunity. This is interesting. There have been so much data, so much research done on this when someone has felt the passing of someone very close to them, whether it's a partner, whether it is a family member, and they look to celebrate, the fact that they even had a relationship. So someone who might say something similar to, I'm so fortunate I've had so many wonderful years with him. He will always be in my memories. That is amazingly helpful. And for someone to actually indicate that they are there, that it's huge. But everybody takes time to get there. Even with a terminal illness, is I have the opportunity to tie things up, make sure I get to do what I want to do these final weeks and months, making the most out of their situations. I have a friend of mine who has a terminal illness right now. She's in remission. She was in remission, and then it became active again. And she told me she had a certain amount of time left. And what she's doing is she turned it around and she says, well, I'm going to live my best life. I am going to go to the places I have not been before. And she started traveling. She's spending more time with her children. That's an amazing thing to see, that courageousness in any person. We can help support other residents and each other in that process. Allyship, it's huge here in terms of support. being able to recognize that folks have strengths and allow them their grief as part of this. But it is potentially it is a potential goal where folks can get to a place where they can adjust. Many people in general have had to do that behind the last 3.5 years that we've survived. So the residents that are courageous enough to be in your facilities that are trying to deal with their own medical conditions, the you folks who have been as practitioners and as other nursing home staff who are constantly engaging with residents have the ability to notice whether or not there are some signs or some behavior changes that can be an indication that perhaps maybe they will benefit from your support. So supporting the nursing home resident grief process, well, early intervention may interrupt the grieving process. Yeah, I have to sometimes understand that while there are no very specific diameters here on terms of what is appropriate, what is not appropriate, depending on the individual. Early intervention and trying to intervene, trying to maybe strongly encourage someone to speak to someone might interrupt their grieving processes. Many residents may have already healthy coping skills, and allowing them the space and the time to be able to go through their feelings in a healthy manner while we are giving them support, while we are being aware of what they do, what they say, that their health doesn't debilitate, that they're still engaged in their treatment process. That's important. So sometimes there have been situations where a provider will go in and actually start to try to strongly encourage an individual to speak to a grief counselor long before they're ready. Because everybody grieves differently, you will have to elicit and just engage with the resident and learn from them if they are open to having certain supports that you might be able to give them. So residents who experience complicated grief, may be the best ones to benefit from the grief counseling. Complicated grief is long lasting, so it lasts longer than maybe say 3 months into 6 months. So you have long-term residents in your facility that may be still experiencing these intense feelings, still having sleep apnea, still acting irritably, and those folks may be the ones who may be the best to benefit from a grief counselor. Trauma-informed support is always essential when we work with residents, because we don't necessarily understand the whole the extent of the grief that folks are going through. We don't want to re-traumatize anyone. We don't want to re-trigger anyone. Residents are very vulnerable while they're grieving, and so we want to be trauma informed and very preventive in how we engage and how we speak to someone in terms of not making assumptions, in terms of being empathetic, in terms of asking them, just literally asking them if they need water at the time, would they like to speak for a little or talk with you for a little bit, would they like to go to to the meal room, so there are certain things like that you can do to show support that can be very trauma informed, and can be very it can reflect the compassion that you from their part. They can see that in you, and they can start what that does is for a resident, it can help them increase their trust and that they can talk to you if they need to share some of that burden, that emotional burden that they carry in their hearts. And so offer information about and provide access to grief support groups. There are different ways that you can do that. There are some that are online. It's easy to access podcasts. It wouldn't be a bad idea if you were to be able to kind of even put on their phones. There are certain grief support groups they can easily access in private. And so there are different capacities that you can give them in order for them to be able to do that. Sometimes when closed social media groups are grief focused, and a person has the opportunity to participate and not necessarily share their identity, or just even listen on or read on what other other people who have lost in their life, and that can be a supportive option for your residents. You as resident nursing home resident staff, your residential staff, you may want to also just be mindful if the behavior changes that you're used to seeing are not what you're used to seeing. Those can be like the indicators that help you kind of listen information and start to see if they need more support. So the night eating, the disruptive sleep, unusual weight loss, the irritability, any combination of that. And certainly the social isolation. The idea is to stay in touch to keep the allyship, stay in touch with that resident. There are times where you will finish your shift and you will go home and you will want to come back. You will come back and check in with them. Understanding that some of these cues can be very indicative and helpful to know about. Help folks understand that they can have the time and space to be able to grieve appropriately, or according to how they want to grieve. Allow the space and the patience on your part for folks to go through their feelings. And sometimes they will be irritable. It's not anything personal towards you. It's what they're still adjusting to. And so supporting residents during their grief and loss, you might want to say things, some of the verbiage you might say, like, just notice that they may be going through something, and you can name it, and you can actually identify it and say, it looks like you feel overwhelmed. And that acknowledgement can give the resident that opportunity to see that you kind of understand that they are going through some feelings, and maybe you're the person they can talk to. So understand that you can say things like, there's so much going on. Can I help you? Is there any way that you would like me to help you? Or things like, I'm really impressed about how well you have been handling everything that leave after all this time. If it's appropriate, you can give an affirmation, or you can even say, it must be tough, I'm more than happy to have a chat with you when you need. Don't forget that I'm just right here. Just call me if you ever want to talk. I'll be here with you during the whole shift. I'm here until such and such. I'm going to make my rounds now, but I will be back by this time to check in with you. Is that okay? Even asking them, is that okay? Giving them that autonomy can be so supportive. So you can, and if you're having a talk with them, if they are sharing with you how they're feeling, you can ask them, so what's the hardest part of all this? In a way, like, to further the conversation, you can ask open-ended questions so they can share more. One of the therapeutic aspects of grief can be when someone is able to share more of what they're feeling. That lessens the intensity of feelings and helps the individual, the resident themselves, to be able to understand how they're getting through, how it doesn't feel as intense. And it can give them hope that they can get through another day, and it doesn't have to be as super harsh. So there's different ways that you as a nursing home staff can show that you're there for them. So some of the things I wanted to think about is, so this is thinking about what we can see in residents, what we can notice, because we do know that you experience this from time to time. At the same token, we also thought that it'd be very important for us to talk about how healing from grief and loss happens amongst nursing home staff. So I would like to touch on this very briefly, and there's certainly more information that can go on for this. And so here, I just kind of want to talk about some couple of myths. You as nursing home staff, you are you're educated, you have experience, you're constantly working with so many different people. Now, those clinical care plans are very different. They're very tailored to each individual. It's a high energy job with a lot of residents on any given shift that you're working. And so there's some myths that include that because this is part of your daily work activities, that it's normal for nursing home staff, of course, to build relationships and friendships with residents and family. That part is appropriate. That is what helps you connect with that individual so that resident can be more proactive in their own process. It's nice to be able to see that the nursing home staff is not just there to give them, whether it's physical therapy, their medication, to take them into the meal room, but to see that that person is a person that they have some kind of friendly rapport with, that's um, extremely helpful for an individual who may be in your facility for a long period of time. But it's also common for many nursing home staff to consider that a transition or resident passing is part of the job. This is not to say that it doesn't happen, but for some folks, it might come up with some ideas, like for instance, like professional boundaries, that this is that we should be able to handle it because you're used to seeing it, because it comes with the job. Well, professional boundaries for some staff, they consider that, staff shouldn't experience grief after resident death. If you're professional, as a professional, you shouldn't have to experience and reflect that or experience losses. You're supposed to be the strong person. You're supposed to be able to deal with it as with a grain of salt, so to speak. And so, you know, um, they might have staff that might consider that grief is a sign of enmeshment or countertransference and somehow reflect a sense of incompetence professionally, or nursing home staff might appear, or should always appear as strong in front of the residents, or grieving staff can't help residents who are grieving themselves, or nursing home staff um, should always provide, nursing home staff are always provided the necessary tools to deal with transition, with resident passing. But the reality is that even if they're not directly on your shift, it's just the fact that they are in the community, that they're in that environment. When a resident passes, nursing home staff do feel it. But the idea is for you as nursing home staff to, even though you're always focused on the resident, you're always focused on the treatments that they need to get, and all the protocols that you have to follow, and all that, and all the responsibilities you have on any given day. Sometimes the thinking is, well, I'll deal with it later. I know I'm human, but I deal with it later. Right now, I have to do this. Later, what happens is other priorities in your life can take over. When you don't take the time to process your own feelings, to acknowledge acknowledge and recognize that you are feeling something behind the resident's passing, that can build up after a while. And so some of the things that your facility can actually practice, and consider that some of these symptoms that I spoke to for residents can be applicable for nursing home staff. So something that the facility can do, I'm going to introduce you to, oh, I forgot I had this question here. Let me just ask you. So with your own experience, if you don't mind, what are some of the emotions that nursing home staff seem to experience after the passing of a resident? And if you like, you have access to the chat, you can post it here. See, that was interesting that you put that there. There's the guilt and sadness. Many times what happens with nursing home staff is like they internalize as if it was like they could have done something different. Now think about the 5 stages of grief. The 5 stages of grief also include that anger, and sometimes that bargaining or that blaming part where a staff member, I think, I have just seen them yesterday, what did I miss? And then that guilt can really drive someone and rent a lot of space in your head and really affect you in terms of how you're processing feelings. The sadness, the defeat, yes, it's an interesting word. Many are then desensitized. Thank you for putting that. After what, it's interesting because when you start to feel desensitized behind passings, and there are times where we've had, what you've had to deal with, like say, for instance, during the pandemic, and the losses that you folks experienced in that environment must have been excruciatingly taxing. And so one might think that you're desensitized, but what's happening is that the body and the mind is really kind of just numbing you to be able to process that. That's kind of like an emotional protection. And I spoke to that a lot earlier, but somewhere along the line, it is really important to consider how to process that, how to process the impact, taking time away to just stop and take care of yourself. So some of the things, and that's true. And if you refuse to talk about it, and it's interesting, let me bring that up. So when I wanted to introduce this concept to you, the postvention, which is when the facility themselves can have these protocols in place where there is a passing and they can immediately have an arrange for a debriefing. And this is often a debriefing that's done with the staff, particularly at first with the staff that had direct contact with the resident who passed. Um, Resident death impacts all staff, direct and indirect, administrative and direct staff, not just the nurses, not just the nurse assistants, if you're going to do it, it's ensure private space. It is an opportunity, offer the opportunity in the space for voices to be heard. One of the things is, when Darlene is mentioning this, I wanted to make mention that because people do grieve differently, we also must be allowed our own space and ways to process feelings. Because the idea here is, if you don't refuse to talk to staff, if you can at least provide the support, just showing that you are providing that support can give an opportunity for someone to come back and talk with you, say on a one-on-one basis, or with other colleagues or other outside sources that can provide grief support. The idea is that it might take time for that person to speak on it. Not everybody's going to speak in a group. Not everybody's going to speak to the facility resource, but allowing the space for them to process is key. And letting them know, the facility can let staff know that they are supportive of their process. Getting through the early days, you may feel like, besides huge grief, a sense of being in a dream, that's a realness, being disconnected from the rest of the world. And we don't want to dismiss that in your humanness that you do feel. And so your competencies and your level of capacity and your proficiency in the work that you do is extremely important for the resident community and to your profession, but your humanness gets involved in this. And so you want to take care of yourself first. Just the same way you put all that time and energy to taking care of the residents, you want to not forget yourself. So be aware that the energy, the grief might take. You may feel fatigued quite a bit initially, or just draining. What a typical day may be more tiring than usual. Drink lots of fluids, keep healthy, eat healthy foods, eat like nutritious foods in meals. Don't skip meals, keep nutritious snacks around. Be able to still take the time to sleep. Ask your family, those people around you that you're normally around, whether it's family, friends, partners, to treat you gently. Let them know that you are in a space right now, that you're going through feelings, that you're going through some changes, and that it's really important for you to have that space. So tell them that you're going to survive it, but you need time. And so again, the hope is that you will find the meaning and joy. And even if at the moment it seems like another issue, like something else, probably not even just impossible, maybe not even thought right now. The idea is to be prepared for the roller coaster of emotions. The guilt that sometimes as nursing home staff that you feel, that can pass. It shouldn't last. If it's normal and good for you to go through these feelings and then eventually get to a place of healthiness, and whether you laugh, where you will smile again, where you can celebrate having known that person in the first place, that's great. You can consider the 5 stages of grief. Be aware and prepare yourself. And this is an interesting part, is when people mean well, want to support you, and it says here hurtful comments, but sometimes friends and family and colleagues, what they share with you, the comments they share with you are not necessarily helpful, but these are folks who are trying to give you support. Sometimes an individual may be saying something more out of a need for them to have to say something to you, not necessarily because it's going to be helpful for you. There's no preamble that speaks to the appropriate verbiage to provide another individual who is grieving. But folks mean well. And so patience on your part will be really important. I will say also that many people just don't know how to talk about loss and that, and sometimes they'll say things that is not appropriate for you. They may say things that speak to more that might be more obvious, like you already know. A lot of times when you are in a situation, people will tell you something that you already know. It's like, that's not exactly what you're looking for. Sometimes it's okay to tell someone, thank you for that, Monique. Sometimes it's okay to tell someone and say, listen, when I'm sharing or when I'm sharing my feelings, it's because I need to kind of get it off my chest for now, but I don't need a feedback. I just need a listening ear. If you can do that, be great. And so that can be helpful, but also be patient because people mean well. If people care about you enough to want to be there for you and try, and they don't necessarily find the words that are appropriate, I know that there is such a thing, at least we can be patient with that. So promoting nursing home staff wellness can include the following. And so set aside time every month for staff members to meet for potluck and discussion. It is possible you can, or it can be in the facility, it can be outside of the facility. The idea is that you can meet together and even kind of discuss openly about not just the transition of the individual, but even their personality, kind of in a celebratory manner. So encourage staff members to develop and maintain extracurricular activities. This is especially important for us to remind each other, especially important for those who are supervising, to remind folks, because you want to balance that out. You still want, as nursing home staff members, you still want to participate in life because that has to balance out some of the impact of some when residents pass from that grief and loss from the work that you do engage in absolutely every day. So take the placing the caps on patient population where when there are staff shortages. I know there's huge issues, logistical issues around this, but it can be especially taxful for individuals who are experiencing loss at that moment. And it may impact their ability to kind of be completely present for any given resident. And so taking that time to process is part of a healthy workforce. So empower staff by using shared decision-making processes. Encourage feedback and input from staff. Sometimes the administrators and maybe the leadership folks are the ones who need to model wellness. If we can model that with each other and delegating responsibility and supporting each other during grief and loss, acknowledging that in your humanness, you also feel it, acknowledging and supporting each other in those processes, it's really helpful to not take one person take ownership of those feelings. It's really helpful to have the support around. So one of the things that I thought might be helpful is sometimes we have so much experience and so much time and so much years in this profession that we may have found ways that are healthy ways to cope and deal and process grief from the nursing home staff, the nursing residents that we, particularly those that we provide direct care to. And so, because it can be a very abrupt shock when someone all of a sudden does not show up. You can't pick them up for physical therapy, or you go into their space to check on the medications they're due and they're not there. It can be very abrupt, even if you've been in the business for years. So sometimes you don't necessarily pick up on that. So something that might be a helpful tool for U.S. nursing home staff members could be this brief questionnaire. And so I'm very much from the school of not 100 questions just to find out where I'm at. Something brief, something simple that can indicate some of the things I may or may not necessarily think about normally. And so these 5 questions are just simply for you as a tool for you to use in your own self-care. And so being able to identify the kind of feelings you're going through, particularly if you're starting to feel like you're not feeling like yourself, perhaps you may have engaged in the dialogue you had with a couple of residents and maybe a couple of your colleagues kind of seemed a little off, or you may have been a little irritable, and you don't think that you're denying that the residents passing a couple of weeks ago didn't affect you. So this grief questionnaire can be very helpful. So how much you're having trouble accepting the death of, how much does your grief still interfere with your life? How much are you having images or thoughts of? Are there things you used to do that you're not doing? How much are you feeling cut off or distant from? These 5 questions are very simple, very unintrusive. This is a questionnaire that you can use just for yourself. And help yourself kind of look at what potentially you may need in that moment. And so everybody tends to have wellness days. Everybody tends to have opportunities to speak to the leadership and say, this is where I'm at right now. And you have the opportunities to get that kind of support. So I strongly encourage you folks to kind of consider this as a self-check opportunity. And that's all that is. And we'll send that along as well when we send out these slides. So this is some of the things that we talked about um, in terms of grief and symptoms and things that you as nursing home staff can do to support residents. A lot of what you can do to support residents are the very same activities you can do to support each other and yourselves. And so, and I do hope you do because we need you. Our communities need you. And so with that, I would just want to ask, is there any questions that anybody has?